The media houses, ladies and gentlemen, this is a press release on the looming global COVID-19 pandemic, and of course with South Sudan Youth Organization Coalition in collaboration with Uganda, Rwandese, Congolese, Burundians, and Kenyans communities in South Sudan are here to release an immediate praise. We members of South Sudan Youth Organization Coalition in collaboration with East African business community leaders jointly to aware communities, coordinates, monitor cases and events of COVID-19 in connections with the Ministry of Health, high-level task force, committees and partners within and at the borders of South Sudan. Would like to thank the government of South Sudan under the leadership of His Excellency Salva Kiir Mayardit through the Ministry of Health with continued efforts to contain the world deadliest pandemic, COVID-19. The formation of COVID-19 task force headed by the President of the Republic, General Salva Kiir Mayardit, with hopes to achieve much needed actions to fight against the looming COVID-19 into the country. Given the fact that all the neighboring countries have already registered cases of COVID-19, raising alarm and fears to seeing cases of the virus in South Sudan now and in the future. Being mindful of government, Ministry of Health, WHO, partners, continued to efforts and orders including airport lockdown, South Sudan borders, closure of schools, church services, bars, clubs, sports, wedding ceremonies, reductions of passengers in public transports to encourage social distancing, cinema and betting centers, half-day working hours, closure of shops with non-food items, and any other social gathering to prevent the COVID-19 infection spread. However, the coalition would like to demand the government and partners of South Sudan, the coalition would like, especially the COVID-19 task force, to urgently take the following actions in an effort to prevent the looming COVID-19 pandemic from spreading. 1. We urge and encourage the high-level national task force against COVID-19 to speed up and widen the coordination mechanisms among different stakeholders on rising concerns in reporting and monitoring chain. We will also encourage the high-level task force to inspect the installation, testing, and isolation centers at all borders, as well as checking people's movement in and out of the country. The much needed resources and materials needed to be channeled to the people, to the public domain to address issues of training, capacity development, awareness, establishment of quarantine, and voluntarily testing sites across the country is still not done and need to be done. Lack of information on dispatching and channeling donated masks and other approved protective kits is creating panic and fears among the civil population. Thus, this is needed for sense of massive sensitization to the public. Until now, the public is still not aware about the centers meant for testing and quarantines, location for public ownership and reference. The public spaces, including bus parks and markets, are still not provided with washing and protective gears. We then urge the government to install an overdue hand washing equipment and detergents in public places. In this regard, the residents are still not informed about the future plans of the government on what will be the way forward, since the country is on partial lockdown, especially looking at health, economic, and social aspects. Therefore, we urge the high-level task force to provide public with relevant information on plans to support the public during this lockdown. Following the reduction in public transport load, prices have shot up, and this is affecting the common citizens, so there is a need for government to regulate such happenings during critical period, especially subsidizing public transport fee. The borders, most especially Uganda borders to South Sudan at Elegu, through Nimili, Eastern Equatoria, through Nadapal, and many other porous borders are likely posing more threats in spreading COVID-19 to the country. This is because the growing smuggling through bribery and tipping by those who want to come in illegally. Therefore, the high-level task force on COVID-19 should ensure maximum orders to control this and increase supervision on these key points. We have observed with concern the manner the transit good vehicles drivers are being subjected to adhere to the guidelines of COVID-19 prevention, and we demand proper screening at arrival at the end of delivery of the goods. We demand all transit goods vehicle not carry more than 2, only driver and co-driver. We urge the government and the Ministry of Health monitor the movement of cargo drivers from their entry to the time they exit. There is still no financial package to protect and boost small local businesses to survive during and beyond COVID-19 lockdown tragedy, as we have seen tremendous closure of local businesses across the country. We therefore urge the government to establish subsidies packages on food items in the local markets. We demand that government provide food assistance to its citizens during this critical partial lockdown of the COVID-19 crisis. We urge the government and COVID-19 high-level task force to provide alternative, clean and affordable drinking water to the citizens apart from the hand pumps, water points which attracts crowds and are likely to increase the spread of the virus. Established a mobile team testing sites midway borders leading to capital Juba to address issues of these persons smuggling without due process of COVID-19 screening and testing. We urge the Ministry of Health to locate the distribution centers and the healthy use of masks, as well as the period to dispose them. We propose all health centers, clinic, pharmacies to be trained and to be given equipments to handle and communicate suspects' case to the Ministry of Health Emergency Department. We re-emphasize that the fight against COVID-19 is a collective responsibility for all citizens and should not be left to the government and the high-level COVID-19 task force and partners. The Ministry of Health, through high-level task force, should continue to frequently update the public on COVID-19, especially through the media houses and other channels that will ensure that information reaches all corners of South Sudan. The security forces should use appropriate measures in enforcing the government directives on COVID-19, but rather informatively engage the public peacefully. The Ministry of Health should urgently constitute professional counseling committees to cancel all COVID-19 suspects before being quarantined. This will reduce on level of psychological trauma and stigma and encourage people to voluntarily go for tests. The Ministry of Health should strengthen and fully equip its medical isolation centers all over the country to respond effectively in case of COVID-19. We still call upon network providers companies to lower their call rates, and offer free data to the public to access information on COVID-19, especially during this partial lockdown. We still remind the high-level task force to include civil society, youth, women, and faith-based organizations, foreign community leaderships in South Sudan into the high-level COVID-19 task force. This will ease the fight against the virus. Thank you very much. God bless you.